The N-Momentum study, which is a randomized, double-masked, placebo-controlled trial of Inebilizumab in neuromyelitis optica spectrum disorder. This was a large undertaking. It involved 99 centers at 24 countries, and the goal of the study was to determine whether this monoclonal antibody that depletes B cells was clinically effective at preventing relapses, attacks in neuromyelitis optica spectrum disorder. And we found that use of this drug versus placebo reduced the risk of an attack by 78% in patients who were seropositive for the anti-aquaporin 4 antibody. And the drug also reduced the risk of disability by greater than 60% and prevented new lesion formation by more than 40%. And lastly, and I think very importantly, prevented NMOSD related hospitalizations by greater than 70%. So these results were very positive in the primary endpoint and 3 of the 4 key secondary endpoints. The 4th key secondary endpoint that it didn't meet was an effect on binocular low contrast visual acuity, and this is probably because of the low frequency of optic neuritis events that occurred in the trial. So overall, in terms of adverse events, these were balanced between the 2 groups, those treated with Inebilizumab versus placebo. Infusion reactions were also quite balanced between the 2 groups, and the drugs seemed to be overall generally safe and well tolerated. Now, those qualifications are, of course, up to the regulatory agency ultimately, but this drug did deplete B cells and was found to be effective at preventing attacks, preventing disability worsening, preventing new lesions, and lastly, and very importantly, preventing NMO-related hospitalizations. So hopefully, after the drug has been filed and reviewed by the FDA, we will find out whether this will be an exciting treatment for patients living with NMOSD. And this is a disease state for which currently there are no approved therapies. This trial was one of 3 clinical trials that have had positive readouts and are being presented at this meeting. So it's extremely exciting for people who have been taking care of NMO patients for years using empiric-based treatments to now have 3 therapies potentially coming to market in short order that are all proven to be effective with understandable safety profiles, each drug with a different mechanism of action. So this has just been a spectacular meeting for NMO.